Hello, I'm Dr. Paul Vanek, and today I'm going to speak to you about Renuvion energy, which is called helium plasma. This is a technology that we can deliver through a tiny little tip under the body, under the skin, in the neck, in the arms, in the back, flanks, thighs, the areas that you don't like. We're able to shrink wrap using a state-of-the-art technology. The way to explain the physics of this is to understand how there are 4 states of matter. Think of water when it's ice. Think of water when it's liquid. Think of water when it's heated and made into a gas. If we pass helium gas through a wavelength of either electricity or radio waves, we're able to make it into this Tesla coil, which is called helium plasma. We take advantage of that helium Tesla coil, and we're able to heat up the tissue that's under your skin. There's a network of fibrous connective tissue that we're able to thermally stimulate and take advantage of it. I combine it with vaser liposuction. The vaser goes in and pops the fat cells. We get some good shrinking, which I published some years ago. But then we take Renuvion and we pass this helium energy under the skin through a tiny 1/8 of an inch incision, and the Renuvion energy, after it cools, stimulates your body to shrink wrap your skin and shrink wrap your tighter areas. Well, what does that look like clinically? We take a woman who's this size, we can harvest her fat using vaser energy and take the fat cell and then deliver it in another place she loves if she wants to repurpose her fat into her booty or into her breasts. But she has this kind of loose skin and these tethered areas that are rolls, and through an incision right here, right there, and an incision right there, it's nearly imperceptible, we can really change the game for her and give her that kind of bodice dimensional change. Her skin is no longer redundant. If you think about just sucking out her fat, her skin is going to become floppy and lax because you take the tissue away and the skin doesn't shrink, is not stimulated to shrink wrap. Both vaser and Renuvion have been shown to substantially reduce the amount of lax skin and shrink wrap the skin. And we're able to combine it in a way that's technological and safe. So we take a woman who has this back roll, which she doesn't like, this tether, and look at her contours now. The incision's right here. Yes, I did do a tummy tuck on her. There's her scar at 4 months. Yes, I did take her flat bottom and make it nice and round because I repurposed her fat from her tummy and her flanks and her back to make a Brazilian buttock lift. But that's a separate story for people who want to do that. Not everybody wants to do that. Most people just want to take away this zone, and we call this flanks, this is a horrible name, and we take away this zone, which is back, to get there. We can combine that with a tummy tuck technique or a breast lift or a breast dog or whatever is your mommy makeover that you want. So a different view of the same person, we take away this amount of skin, this gets lowered down to here, and then we thin what's in the front and we thin what's in the back, and we do it with radio waves and ultrasound, and that's what I call surround sound, just to have fun with it. Her incision's right here, her incision's right there, and then her tummy tuck is her choice if she's a candidate for that based on her anatomy and her fertility. But look at the transformation of this woman in a few months to go from this laxity to this body contour and adding fat to her round bottom versus her flat bottom. All in one recovery, one downtime. Even for people who are in their high 60s that have poor skin tone, Renuvion and vaser combination will take away the chunky roll around the side through an incision that's very tiny. Someone who's in their 30s or 40s, we can have a substantial improvement in her contour of her back and vaser flanks. This is at 1 month, and this is combined with Renuvion. But here's the story you want to see. Through this tiny incision, whether I do a breast lift around the sides, you can see poking out here, this is the focus of her back, that she was here with, grab this in your mind's eye, and look at the contour improvement of vaser Renuvion back and flanks. So when we get to patients of different ages and weights, I'll talk to you about the details of setting your expectation. The recovery is have the surgery, you can go home. If you have a bigger surgery, you can stay overnight at Tri-Point Hospital. But essentially, when you have the surgery, you can be rest assured that you'll have some swelling, you'll have resolution of the things that bother you, and look at how smooth that is after her body contouring through this back and flank incision. I can do single areas in my office with Renuvion and vaser. So you come in and we put a little fluid in here. That's local anesthetic. You're pretty comfortable. It's a little spicy when it goes in, but I'll talk you through it. You get a little oral sedation, take a little puffs of some helox and you're happy with what's going on. A single area is something that you can go back to work in a day or two. I don't let you drive home. I'm sure people that are motivated are going to ask me that question, but people can have somebody drive them home and see you back again tomorrow. But here's the score right here. We take a person who has a little back area that they don't like and a thicker area here. She already had a tummy tuck, but she wanted to do a touch-up of this area and just make this area better with a single intervention. Renuvion is helium plasma. Vaser liposelection is ultrasound. Think of it as radio waves, and ultrasound is surround sound. I'm Dr. Paul Vanek, Mentor Plastic Surgery and Med Spa. See you soon.